Did you know that 25.8 million children and adults in the United States, that's 8.3% of the population, has diabetes? According to the American Diabetes Association, 26% of these people are under the age of 20 years old. Many Americans know at least one person with diabetes, but most probably couldn't tell you what the disease is, what causes it, or how it is diagnosed. Although type 1 diabetes is less common than type 2, it is important to develop an understanding because more people are affected by it, whether it be directly or indirectly. After noting that type 1 diabetes is less common, you may now be curious as to what makes type 1 diabetes different from type 2. If you refer to slide 2, you will notice a chart of the key differences in the two types of this disease. While both are controlled by insulin injections, the first difference is that type 1 diabetes is onset at a younger age, while type 2 is primarily diagnosed at an older age. Those diagnosed with type 1 diabetes are typically under the age of 20 years of age. On the other hand, the majority of those whom are diagnosed with type 2 diabetes are between the age of 20 and 60 years. According to the 2011 records from the American Diabetes Association, 11.3% of all people in this age group have diabetes. However, age is not the only difference in these two forms of diabetes. Those who are diagnosed with type 1 experience a sudden onset of symptoms, including but not limited to frequent urination, excessive tiredness, and excessive thirst. While with type 2 diabetes, these symptoms occur over a longer period of time. This gradual onset of symptoms delays the diagnosis. The most important factor when considering the differences is insulin production. With type 2 diabetes, the body is unable to produce enough insulin, while in type 2 diabetes, the cells are resistant to the insulin. Insulin helps the cells take in glucose and convert it to energy. When the pancreas does not make enough insulin or the body is unable to use the insulin that is present, the cells cannot use the glucose. The chart displayed on slide 2 gives a few other examples of what makes type 1 different from type 2. As we move on to the causes of type 1 diabetes, you may notice some of the information is similar to that which was previously covered. It is not exactly known why type 1 diabetes develops. However, it is thought to be correlated to genetic factors. Those at the New York Department of Health also believe it may occur after a particular virus. While its origin remains a mystery, its development begins after the body's immune system had destroyed the cells in which insulin is produced. If you would refer to slide 3 in the PowerPoint presentation, you will notice a diagram which illustrates the difference in healthy insulin-producing cells and those that have been destroyed. As we now move on to how type 1 diabetes is diagnosed, I will ask you to take a look at slide 4. This slide lists the 3 primary methods to test for diabetes: glucose tolerance testing, random blood testing, and urine samples. The results from glucose tolerance test and the random blood sampling are similar. They represent the amount of glucose present within the blood sample. If the blood glucose level is higher than 126 milligrams in the glucose testing, or if it is higher than 200 milligrams in the blood test, you may be diagnosed. The diagram displayed on slide 4 goes through the steps of a typical glucose tolerance test: fasting for 8 to 12 hours, drinking glucose, and then are given a blood test 2 hours later. The 2 types of blood tests are the most effective way to determine the diagnosis of diabetes. Lastly, we will discuss how type 1 diabetes is controlled. Those who have this type of diabetes have to have insulin injections in order to survive. Rather than administering an insulin shot every so often, it is common for a type 1 diabetic to have an insulin pump adhesively attached to his or her hip. These pumps administer the needed dosage when it was required. If you look at slide 5 within the PowerPoint presentation, an insulin pump is displayed. Other than insulin injections, it is important for a type 1 diabetic to maintain a balanced diet, routinely check his or her blood sugar, and be physically active. According to the Juvenile Diabetes Research Foundation, watching carbohydrate intake seems to be very important in a diet for maintaining a regular blood glucose level. The last method to control diabetes is physical activity. This is an important step for anyone to maintain a healthy lifestyle, not only those with diabetes. As I come to a close, I hope I've provided you with greater understanding of type 1 diabetes as well as the causes for this disease.